Hi, my name's Elizabeth Dennis. I'm an associate professor in the Department of Physical Therapy and Rehab Science at the University of Maryland School of Medicine in the United States. So, what can be done to improve the number of people who receive simpler six actions? Changes can target increasing the capability of health workers, patients, and carers through better knowledge, skills, and understanding. It's also important to create opportunities to make the right thing to do easier to do. Finally, it is important to consider improvements that motivate people to do the right thing. Over the next few slides, we will give examples of lots of different improvement ideas. Some of these will be very helpful in your setting. Others might not actually work. Don't try and do all of them. Actually, we suggest just selecting and testing one change that might lead to improvement. Then work with your local team and patients to see if it leads to an improvement. If it does, then keep doing it. If it doesn't, make a change or try something different. This approach is supported by the Model for Improvement and the COM-B. If you want to know more about these, links are available in the references section of this unit. So what can be specifically done to help improve the use of oral nutrition supplements? First, it's important to improve the capability of staff through better knowledge, skills, and understanding. It is very important that staff understand why nutrition matters, especially for people recovering from a hip fracture, and how oral nutrition supplement can support their recovery. Next, staff need to know exactly what their role is when it comes to giving, prescribing, and following up on ONS. This includes all disciplines, not just dietitians. We need to support staff in using the right systems to check, record, and review ONS intake. It is also important to normalize discussions about ONS during daily handovers and discharge planning. These conversations help reinforce that nutrition care is everyone's responsibility. We should also do things to improve the knowledge and understanding of patients and carers. It is very important that patients, or their carers when required, understand why nutrition matters and how ONS can support their recovery. To help with this, staff should be supported to give patients clear spoken and written information about ONS. It is also important to encourage patients and carers to ask for ONS when needed. Empowering them to speak up can improve care and ensure no one misses out. Staff should also work with patients and carers to recognize and manage the common barriers that can stop patients from taking ONS, like taste, timing, or confusion around purpose. To improve how often patients actually receive oral nutrition supplements, we also need to focus on creating opportunities. This means changing the environment and social systems so that the right actions are easier to take. Here are a few examples of opportunities that could be applied in everyday practice. Start by making sure that a range of ONS options are available and suitable for your local setting, and that staff are clear about what counts as an ONS. All hip fracture patients should be offered the oral nutrition supplements until they are clearly eating and drinking enough, and they have been assessed as well nourished. You can create opportunities as part of routine care during rehabilitation and mobility sessions. Oral nutrition supplements also need to be accessible, not just at meal times, but between meals, after hours, and also in the gyms and other rehab settings. Policy, procedure, and pathway updates might also be needed to support practice in line with recent care standards. If local documents don't mention oral nutrition supplements or link to national or international care standards and guidelines, it is much harder for staff to prioritize them. It's also important to define and communicate who is responsible for providing, prescribing, and following up on oral nutrition supplements. Everyone should know where their role starts and stops. In more and more settings, doctors, nurses, physios, and others are able to prescribe and provide these oral nutrition supplements. So it should not always be left to the dietitian, and that can delay timely access. Embedding standard ONS orders sets in to IT systems and clinical pathways so prescribing becomes easy and consistent. Finally, IT systems can be used to track what's working and monitor intake, wastage, and barriers, and enablers to ONS use. To improve ONS care, it's not enough to change environments and social systems. We also need to motivate people to care and to take action. One way to do this is to position the oral nutrition supplements as a routine part of safe, high quality hip fracture care, not something extra or optional. Prescribing the oral nutrition supplements in the medication chart, just like a medicine, reinforces its importance and makes it easier to track and follow up. This also means that doctors, nurses, and others are more likely to provide information to patients about what the supplements are for. It helps to explain that the oral nutrition supplements can help reduce complications and support faster recovery. When people understand this, they're more likely to use it. And we know that improving staff and patient understanding of ONS leads to better use and less waste. People are more likely to take the oral nutrition supplements when they know why it matters. Motivation can also be improved by setting team goals that support consistent and timely use of ONS. When goals are shared, people are more likely to follow through. It's also important to audit and report how often the oral nutrition supplement is given, whether it's taken, and what outcomes are achieved. This helps identify gaps and celebrate progress. We also want to connect ONS care to what matters most to the patient, their own health goals. This makes the care more personal and meaningful. Recognizing the ONS champions, whether they're individuals or teams, can definitely help to build positive momentum. And finally, sharing real stories, data, and peer examples can inspire others and help good practice spread. To help more hip fracture patients and others at risk receive and benefit from oral nutritional supplements, the whole clinical team can make a difference. It's not just about giving the oral nutrition supplements. It's about making sure people understand why it's important, they actually receive it, and that we check if it's helping. Nurses are often the first to notice if someone is not eating or drinking enough. They can support the ONS by prescribing it or ordering it, helping patients take it during or between meals, and checking that it's the right type and amount. Nurses also record how much was taken and use computer systems to track and flag any concerns. They play a key role in handovers, making sure the team knows whether ONS is still needed or can it be stopped. Nurses also help patients and carers understand ONS and can encourage them to ask for it if needed. Doctors support the team by making sure ONS is part of the care plan and prescribed as a medicine. They can help avoid long fasting times and make sure ONS is restarted after surgery. Doctors also remind staff why good nutrition matters and help align ONS plans with medical goals. By speaking up, they can drive changes in policy, improve funding, and promote better access to ONS as a standard part of care. Allied health professionals such as dietitians, speech pathologists, and occupational therapists can support ONS care by checking what has been received, helping patients take it safely, and giving practical strategies to staff and families. They also help patients link ONS to their recovery goals and work with staff to reduce barriers to intake. Allied health staff can provide training, support documentation, and help make ONS part of rehabilitation or mobility sessions. Healthcare assistants are essential during mealtimes. They can help patients sit up, open containers, give reminders, or assist with feeding. They can also tell the team if something isn't right and record how much was taken. With some training, they can help patients stick to their ONS plan. Students and trainees may still be learning, but they can support ONS care by encouraging intake, helping with reminders, observing and recording intake, and asking questions. This helps them learn early on that nutrition is a key part of good care. Volunteers, when trained, can make a real difference. They can sit with patients during meals, offer encouragement, and let staff know if something is wrong. Their involvement helps make nutrition care more personal and effective. Leaders and champions across all groups can support good ONS practice by setting team goals to improve consistency and reduce waste, updating policy and pathways, sharing audit data, and recognizing staff who support ONS well. Making sure patients receive and consume oral nutrition supplements isn't just the job of the clinical team. System and support teams like admin, food service, IT, executives, educators, and quality teams make ONS easy to order, track, and deliver. They also support staff with training, systems, and resources to see if they make a difference to nutrition intake and outcomes. Advocates and influencers, such as patients, carers, professional organizations, and researchers, can raise awareness, share real stories, and push for better ONS access and policies. It takes a whole system to make sure ONS is seen as standard part of a safe, high-quality care for hip fractures and other patients at risk of malnutrition. Improvements in nutrition care don't need to wait for a big project or new policy. They can start with small actions at many different times during routine care. For example, improvements can happen when a hip fracture or malnutrition risk is first found, or when a patient arrives in an emergency department or ward. They can also happen during routine care, like when checking a menu, ordering meals, or when the computer system reminds staff to act. Team meetings, therapy sessions, or handovers are great chances to talk about ONS needs. So are discharge and follow-up conversations with patients and families. Improvements in nutrition care can also happen during training sessions, audit, or quality reviews, and they also give staff a chance to learn and reflect. Finally, when updating local policies or care standards or planning funding, there's a chance to make ONS care stronger and more consistent. There are many places across the healthcare system where we can build in better nutrition care. We can update care standards, clinical pathways, policies, and protocols to make sure they include oral nutrition supplements. Food service, catering, and supply processes can be changed to make ONS easier to order and give to patients. Training sessions and staff orientation are good times to build knowledge and skills. Sometimes, even small changes to the physical environment, like signage or where ONS is stored, can make a big difference. We can also raise awareness through reports, team meetings, social media, or other communications. Funding models, tariffs, and incentives can be changed to support better access and consistent delivery of ONS care. There are lots of moments when and where we can take action. We just need to notice them and make the most of them. Don't make it too complicated. Keep it simpler for better nutrition and better outcomes. And let's not forget the digital and electronic places where we can build in better nutrition care. Electronic systems like medical records, medication charts, or care alerts can help remind staff and support good decisions. We can improve the electronic tools we use, like checklists, templates, and prompts. And finally, audit tools, dashboards, and patient tracking systems help teams see what is working and what needs improvement. There are lots of moments when and where we can take action. We just need to notice them and make the most of them. Don't make it too complicated. Keep simpler for better nutrition and better outcomes. We invite you to watch this short 3-minute animation. It shows the difference simpler improvements can make. His journey shows how early nutrition care can really help. Even if you've seen this video in another unit, it's worth watching again here. It might be helpful to look out for things you learned in this unit. After you have watched the video, we will then invite you to take some time to reflect on what you might be able to do and improve in your own setting. It's time to reflect again. What are 2 or 3 realistic changes you could improve how ONS are used in your setting? These could be changes that influence capability, opportunity, or motivation. Also think about who could be involved, when and where the change could happen, and why the change is important. Just put in a few of your thoughts. This is not assessed, it is just to get you thinking. Once you've finished your reflection, you will then see some useful links to some additional resources. After that, please make sure you complete the short quiz to check what you've learned in this unit and to give us feedback about the unit.